Breast augmentation is a very good operation because it always works. There are certain types of operation where if you've got a bad back and you go to an orthopedic surgeon, they'll say, well, there's a 50% chance that I can help you and a 50% chance the operation won't work. Well, I can tell you that if you put 300 grams of a breast implant underneath the breast, it will definitely make it bigger. So it's an operation that absolutely always works. It will definitely make your breast bigger. And so that, in that sense, is a great operation. But it comes at the price of having a foreign body in the breast, and that has implications. So I think anybody coming for a consultation about breast augmentation needs to understand the concept and the risk that they're taking on in having a breast augmentation. Now, thankfully, the products that we now use for breast augmentation are extremely good. They've had an evolution of some 40 years now, and the manufacturers have pumped millions and millions into the product development, and we've got some very, very good product. And I think some of the health issues that ladies who had breast augmentation back in the 80s and perhaps early 90s are now no longer an issue. But what we haven't managed to resolve is the fact that we are still making breast bigger with something which is a foreign body, even though it is a very good foreign body. So that's the first point. It's a great operation. It definitely makes your breast bigger, but you need to understand what you're doing to yourself if you're going to have a breast augmentation, and what the implications really of that are. So the second thing is whether the breast augmentation is going to produce the changes that you're hoping to have in your breast. So quite a few ladies come to me asking for a breast augmentation, but really they're actually very happy with the size of their breast, but it's perhaps the shape that they're not so keen on, and in which case they would perhaps be better off served with an uplift or a mastopexy operation. And occasionally we also have ladies who yes, they'd like to have their breasts bigger, but if we just put an implant in, that will lead to a slightly odd-shaped breast, which is unlikely that they'll be happy with. So in those patients, you usually have to say to them, listen, I think, yes, we'll put an implant in, but I really think we should do an uplift as well, because that'll give you the most natural shape of breast, and a breast shape and size that I think you'll be comfortable with. And so in the consultation, really, that's the key point, is to take that those concepts further forward. And I do that, obviously, a mixture of discussing everything with the patient. And we usually have a look at a series of previous patients of mine who've had the various different types of breast augmentation, the various different shapes and sizes, and we usually we're looking for similarity between the patient and previous patients that we've seen, so we can discuss these issues. Obviously, if you're having a breast augmentation, it's important that we're aware of your health and your breast health. Anybody over 40, I always do a mammogram beforehand, just to make sure that everything is fine from the breast care perspective. And then it's perfectly possible to breastfeed after a breast augmentation, and millions of ladies do that. I usually recommend to people, if you're imminently deciding on having a family, then it's probably best to wait till afterwards, because the pregnancy itself will actually lead to changes in the breast, and you may want to then change the size or the shape of the implants that we subsequently put in. But that said, if the family is still a twinkle in your eye and nothing imminent, then there's no reason not to go ahead with a breast augmentation. During the consultation, it's important that we discuss some of the key technical aspects that we'll discuss that will happen during the operation. We need to work out exactly where we're going to put the implants, whether we put them underneath the breast itself, or whether we actually tuck them underneath the muscle as well. And usually, as a rule of thumb, if you're a very slim lady, we'll have to pop it underneath the muscle. And if you've got a little bit more covering, especially at this top bit, this cleavage bit, which will be on show, then we can pop it underneath the breast itself. And that's a judgment that we take. And the judgment of that also depends on exactly what type of implant we're going to put in. You also need to discuss the different shapes of implant. Implants come as what we call high-profile implants. These are implants that will make you look very busty, which some people, that's the look that they would very much like to go for. We have low-profile implants, which will give you a slightly bigger breast, but make it slightly less obvious. And then for ladies who have really very little breast tissue, we sometimes have to use shaped implants, which will actually help develop the breast shape. And depending a little bit on the change that ladies are wanting in their breast, the size change that they want, will depend on the advice that I give them as to what type of implant that we use. We obviously then need to, and I usually, after the first visit, I usually ask ladies to go back and do a little bit of homework, where they put some different sizes of breast implants into, usually ask them to get a bra of the size they'd like to go, and they usually come back to me with a range of size of implant that I can then look at and come to the best decision as to what size to put in the patient. Once I know the size, I can then work out whether it's best to be going high profile, low profile, or shaped. And obviously, I then measure the patient to see whether it needs to go underneath the muscle or not. The other downside of having a breast augmentation is you've got to go through the operation. Although that's again pretty straightforward. You nevertheless do have to go into hospital. It involves the operation itself, it involves the recovery period, and as with every surgery, it does involve an exposure to some risks. So I spend a little bit of time talking about that. The procedure itself is relatively straightforward. You come along to the hospital, again you'll see me, I will come along and do the marks that I need for the surgery. You'll meet the anaesthetist, and you then go down to theatre. During the surgery, we usually make a little cut underneath the breast at the junction of the breast and the wall, but we can make that cut in other places and put the implants in. And when you wake up, you've got a bra on. You feel as if your chest has been stretched a little bit and it feels a little bit tight because that's exactly what has happened. But it's not usually an incredibly painful operation, and certainly the anaesthetists that I use are very good at putting local anaesthetic blocks in, so when you wake up people are fairly comfortable. Patients stay a night with us in the hospitals I work. They spend one night with us and then provided they're fine, they get away the next day. For that first week you're walking around, you're washing, you're showering and everything's normal, but I do ask you to keep life to be as gentle as possible, because if you try to do too much, A, it would be painful, B, it would cause some swelling, and C, it might just cause a little bit of bleeding, which we wouldn't want. I usually check the patients at somewhere between 10 days and 2 weeks, just to make sure the wounds are fine, that there's not too much swelling or anything. And at that point, people are normally back to a normal sedentary life. But I advise them it's going to be usually about 3 weeks before they're driving again, and about 6 weeks before they're getting back to the gym. And that's quite important. There's obviously some variation, because if you're putting very large implants into a lady, that's going to be a little bit more painful and might take them a little bit longer. If you're putting small implants into a lady, then actually their recovery might be a little bit quicker than that. So most people take 2 weeks off work if they have a normal sedentary job. The risks that are involved in this procedure, as with every surgery, we are giving you a general anaesthetic. Although very safe, there are some risks associated with general anaesthetic. Perhaps one of the ones that I think every patient should know about, there is a risk of getting what's called a DVT. DVT means deep venous thrombosis, and it's a clot you can get in your leg if you stay still for some time. There's a number of causes of it. It used to be called economy class syndrome, where people got clots in the legs from flying economy class to America. You can also get it travelling on the bus to Glasgow. and you can get it if you have any form of general anaesthetic. It's much higher risk in longer operations and operations which are in and around the pelvis. So this is a fairly low risk procedure, but nevertheless it's there. We give you flight stockings and we give you machines that massage your calf during the procedure. So we try and get that risk to as low as possible. We can't get that risk absolutely to zero. Specific to the operation, there's always a small risk of bleeding after the operation. That's called a hematoma. We'd know that because the breast would swell up. And the risk of that is usually under 1%. And that's why we keep patients in hospital, just to make sure that they're relaxed and they're calm and not running around the house, because that's probably one of the key things that might start that off. If that were to happen, we'd have to take you back to theatre and just wash it out, put the implant back in. So it's a nuisance, but not usually too much of an issue, and thankfully it's very rare. There's also a small risk of infection. Infection would be a problem because if the implant gets infected, it has to come out. Now, that doesn't mean you can't have implants put back in again, but it does mean we have to wait for about 3 months or so, and we can then put them back in. Thankfully, again, infection rate is very rare, and in most series it's well under 1% for straightforward augments. There's also a risk of having wound healing problems, but again, thankfully, the breast has got a good blood supply and we're not making large incisions, and so it usually heals out well. We will definitely create a little bit of numbness around the scar itself, and there's also a risk of a bit of numbness around the nipple. If you do get a little bit of numbness around the nipple, then that is usually temporary, but again, unfortunately, that cannot be guaranteed. So there are certain things that the patient might notice. If you have very prominent veins on the front of your chest, they can sometimes be made a little bit more prominent after surgery, especially if you're having a very large augment. If you're prone to stretch marks and you go for a very large breast augmentation, the stretch marks may get a little bit worse. The effect of the shape on your breast is also important, that you discuss that with the surgeon, and because obviously the shape is going to be changed as well as the size, and that's part and parcel of the preoperative discussion. There are then the implications of actually having an implant underneath your breast that the patient needs to be aware of. The implant itself will cause the body itself will create a little bit of a fibrous reaction around the implant, and that fibrous reaction is called a capsule. Now, everybody gets a capsule, but some people that capsule is a lot thicker and more robust than in other people. And if you're one of the patients that will form a thick capsule, that may become noticeable in time. It may cause a few ripples, especially if you're a very thin lady. So that's why in the thinner ladies we usually pop it underneath the muscle, because we don't want to see any rippling at the front of the skin. But that's something for us to be aware of, and it's something for the patient to be aware of. And the most common reason for a patient to have revisional surgery on their breast augmentation is because of the fact that a bit of a capsule has formed. And so what I usually say to patients is, although the implants we're putting in are very well manufactured and they're very unlikely to fail, it would be sensible to assume that at some point in time in the future, you may well need to have revisional surgery. If you can't really accept the fact that you wouldn't be able to have revisional surgery, then you shouldn't have the implant put in. Although the vast majority of patients probably will not need revisional surgery in time. The surgery itself, if you were to exchange the implants, it's relatively straightforward. We use the same incision. We actually take out the capsule in the old implant and we put a new implant in. But nevertheless, it's an aspect of having an implant put in. It's an implication that you have to understand if you're going to go ahead with this procedure. The other implications of it are when you come to breast screening, it makes it a little bit more difficult for them to do breast screening, although they can breast screen you perfectly well. You just have to advise them of that. And as I mentioned earlier, it's perfectly possible for you to carry on breastfeeding if you subsequently get pregnant after you've had breast implants. There's no evidence that it causes any harm whatsoever.